This individual is a senior employee at one of the largest airlines in the world, at one of the largest airports in the United States, a hub that in the past have received daily flights from China. This individual not only described to me the conditions inside the airports right now, the lack of preparedness, going as far as to note that though they put out disinfecting hand soap, for example, at a communal hand scanning machine to enter the employee area of this airport, but that machine, the very dispenser, is empty. They're not taking it seriously. And this individual noted to me that there's an employee exhibiting, according to the CDC's own list on the symptoms of coronavirus, exhibiting those same symptoms and has gone to the doctor. The doctor doesn't know what this is, this person has. It definitely is not flu. The doctor confirmed it's that individual. And that this individual is not alone in people that have not come to work due to these illnesses. Again, all individuals who are handling bags at one of the largest airports in our country.
This is an individual who is a senior manager with a major world airline based at a major large airport in the United States of America. You're only hearing it on True News. Listen.
Well, my concern is that I had spoken with an employee today that has been sick for over a week, and this particular employee has a sickness of some type that his doctor could not identify. He did take him through a flu test, and he was negative on the flu test. However, he had all of the symptoms of a respiratory illness, as well as he had vomiting, diarrhea, a numerous amount of symptoms that were very relatable to the coronavirus.
Now, did the doctor test for coronavirus or the flu?
Well, that is my concern, because I asked the employee if he had been through any type of screening with the doctor concerning the coronavirus, if he had even been questioned concerning having contact with anyone out of the United States. And the employee stated that the doctor did not ask him any screening questions whatsoever. As a matter of fact, at the end of the conversation, I had brought it up to the employee after just calling to check on the employee that, you know, he needs to be concerned that he may have the coronavirus, and the employee had not even thought about that. He just said that this sickness that he had was like nothing he had ever had before. He's a very healthy individual, young person that typically would get over an illness within a few days. However, he has been out for over a week, and he said that he has been in bed. He just cannot get out of the bed.
Now, what does this employee do? Do they handle baggage?
That is correct.
Now, offloading off airlines, they handle it at the point where you're checking in, or he's someone that handles, let's say, 100, 200 bags a day, even more?
That is correct.
Now, is this employee alone in the symptoms and being sick and calling out? Like, how many employees are we talking about that are experiencing similar symptoms?
I do not have that information. I have just been very concerned because there is no information that's gone out amongst any of the employees, any of the contractors. No one has told anyone to wash your hands. There's not any precautionary methods at this time being used here in order to prevent the spread of any disease. As a matter of fact, entry into the building requires the employees to place their hand on a reader that reads a portion of the hand in order to gain access into the building. And that several hundred people a day have to place their hand on this hand scanner And the issue with that is that hand scanner is not clean. And so every employee or contractor or anyone that is trying to get access to that secured area all has to touch this hand scanner in order to gain access to the secured area. And most of the time, there is a antibacterial uh, dispenser on the wall behind that, but most of the time, there's nothing in it.
Wow, it's empty. The hand sanitizer station that's put in place to help disinfect individuals coming into that closed working environment, again, handling baggage and interacting with both tourists, businessmen, people coming in from around the world, that station for the disinfectant is empty.
That is correct. And I actually I have gloves that I have in my car that I use walking through the airport. And however, I cannot circumvent that. I have to put, because it's scanning my hand, I can't circumvent that. There's no way around that.
Now, since you're at the airport daily, are you seeing an increase in the use of masks? Again, are there any other employees? I know you can't give a number, but has there been a substantial increase in the amount of people that are calling in sick as employees of not just this airline that you work for, but other airlines at that airport?
I do not have information on that. I do see a number of masks worn by the employees. I'm sorry, by the passengers, not the employees. You know, that is what concerns me. There is an absolute denial of any of this coronavirus issue, and I have spoken with other employees, and they look at me like I'm strange. And no one is taking this seriously. There's no warning, no alarms being sent out. Those bags, once an employee handles that bag is taken and placed on a cart. That cart is then taken to a bag belt area. That bag belt area is handling thousands of bags a day. So those bags, you're getting one person to touch that bag. If that one person has corona, that bag is being distributed throughout the entire airport, and that airport has the potential of distributing that coronavirus from that one bag all over the world.
Now, are you able to confirm if the one individual you can for sure say is sick with corona-like symptoms? Again, no doctor has confirmed that this individual has corona-like symptoms, but definitely has said they don't have the flu. Can you confirm if that person had handled any baggage from China or anywhere in Asia?
The agents at the airline handled. It's not discriminatory. They will handle bags from all over the world. There's when the plane comes into the gate, you don't know where the plane is coming from. It could come from anywhere. So all of the bags, all of the agents handle all of the bags. There's no one that does not handle bags from. There's nothing stopping them from handling bags from anywhere else.
My last question is: has the airline company or even the airport itself have they issued any warning, any guidance? Have they given out masks and gloves, and have they said anything to the staff, the employees, about coronavirus?
So, the airline that I work for has given updates. According to what you and I see from the World Health Organization, they have done a very good job as far as letting us know that the corona is in existence. However, there's no precautionary measures or no alarm that says that, hey, we could have it. That's what concerns me, is that for several weeks, our employees were handling bags coming in from China, and there's still no alarm, or no one has said, ask for these people to get tested if they are sick. So if you have several thousand employees And that's just going around and around. And then those people take those out to their family, and then that goes out to their community. But yet you don't have doctors or medical professionals even asking the employees if they have been around anyone or anything that's come from outside of the United States. It's silent. It could be here. There could be hundreds of thousands of people that have corona and they just think they have the flu virus. And something needs to be done within the medical community, and there needs to be an alarm that goes out. It's very frightening.